Hello, my name is Eugene Huang. I'm a professor of biostatistics at the Department of Biostatistics and Bioinformatics at Rollins School of Public Health at Emory University. I've been at the department for 22 years, and prior to that, I was on the faculty at Fred Hutchinson Cancer Research Center at Seattle. So over the years, I've been working on a number of methods problems. I started way back on survival analysis. Then I also worked on cover measurement error problems. But over the last 10 years also, my focus has been mostly on statistical methods for biomarker research. So this research originated from a collaboration with a urologist who is interested in aggressive prostate cancer prediction or detection. We're in this era of precision medicine. So when it comes down to disease detection and diagnosis, what that means is that we would like to use biomarkers like urine or blood biomarkers for better disease detection and diagnosis. So we know that over the last few years, there has been a lot of advances in molecular biology and high throughput technology, like omics technology. So there has been a lot of biomarker candidates that have been identified. But what is lagging behind is their validation and clinical translation. So that's exactly the type of work that we are doing. As a biostatistician, we face a number of challenges and opportunities. Um, there's a lot of development that certainly, could be theoretical, could be on methods, could also be computational. And furthermore, there are some conceptual development as well. I'm going to give you a number of examples that we are involved in, a number of development we are involved in. The very first one is on biomarker evaluation in terms of its clinical utility. So it's very important to evaluate biomarker to see their potential in clinical applications. So this is the reason that we want to evaluate biomarkers in terms of their clinical utility. So certainly there's statistical development involved, and on the top of that, there's also conceptual development. And then often it's the case that a single biomarker may not be discriminative enough for disease detection. And often one might have a number of biomarkers. So the question is how to combine them to develop a diagnostic prediction rule for better disease detection. So there again, there will be theoretical development. Also, there are methods development as well as computational development. Often one needs to develop novel computational algorithms as well. And then once a diagnostic rule is developed, then we need to estimate its performance, its prediction performance in future deployment. We all know if we're going to use the training data and use the empirical performance estimate, the empirical performance estimate tend to be overly optimistic. Ideally, one would like to have an independent validation study to estimate the prediction performance. But in practice, often such an independent validation study is a tall order. In particular, for novel biomarkers, we may not have the luxury to have such an independent validation study. So then a crucial question is whether it's possible to have valid prediction performance estimation based on training data. So those are the few examples that myself, along with my students, have been working on. I've been working with a number of students, both masters and doctoral students, on biomarker evaluation and also development of diagnostic rules. So if you find this kind of research interesting and exciting, please feel free to reach out. I'll be happy to have a discussion. This is a very exciting field with constant opportunities to develop cutting-edge methods that could have a meaningful impact um, on disease detection and diagnosis. Thank you for watching. Have a great day. Bye bye.